Nakuha yung ambulansya. It's fun. Hi, my name is Ronald Recio and I am a clinical psychologist. So I have a diplomate in traumatic stress from the American Academy of Experts in Traumatic Stress. I currently hold a master's degree in clinical psychology from the University of Santo Tomas, and I'm also currently pursuing my PhD in clinical psychology at the Far Eastern University. I chose my field kasi when I was still in my undergraduate years, I've seen na parang ang daming problems ng isang person na non-included or not included sa parang umbrella of medicine na are also impacting a person's overall health. So sabi ko, why don't we broaden the spectrum and look at other holistic ways in changing a person's lifestyle and impacting a person's general health. A psychiatrist is a medical doctor that took a residency and possible fellowship in psychiatry. So ang primary mode of treatment nila would be using medications. And ang primary mode of diagnostics nila would usually look into physiological factors that may play a role in a person's mental state. A clinical psychologist in the Philippines, like myself, I usually may master's degree of education, my advanced training in a certain therapeutic style or a certain therapeutic approach. And then, ang primary mode of treatment namin would be psychotherapy or counseling, pero hindi pareho yung term na yon. And usually, we focus on lifestyle changes. Sa field ko, maraming types of clinical psychologists. I personally am a cognitive behavior therapist. So, ang target ko is changing a person's mindset and orientation in the hopes na magbago yung lifestyle niya at magbago yung mga ginagawa niya sa buhay niya. Okay? And we also excel in diagnosis by giving mga pen and paper examinations, behavioral observations, and mga projective techniques. But again, depende yon sa type ng practice ng psychologist na meron ka kasi magkakaiba din kami sa ganong aspect. I think people should read yung mga bios namin before they consult kasi doon naman usually nakalagay lahat. Kasi you can't expect a certain treatment na kasi hindi kami pare-pareho ng tingin. Okay? So if you're to look at my demographics, karamihan ng patients ko would be from the parang late 20s up to early 40s. So majority of their problems would fall under work-related stressors and general changes sa life nila. What does this mean? General changes like nag-break sa jowa, things like that. Hindi alam anong career direction, tama ba yung tinatahak nilang path, or so work-related, should I abandon my career? Should I change my career? Or sometimes nga pati yung mga accidents related to that. Accidents na mga trauma-related as well. So yun yung mga usual consultations na nakukuha ko. In the diagnostic sense, majority really do suffer from burnout, especially during the pandemic. Marami during that time. And since na-open up na kasi yung conversation on mental health, mas naging, I would like to use the word, sensitive na yung people on certain symptoms na nararamdaman nila. Okay? So aside from burnout, usually mga anxiety and depression related problems. And anger. Actually, interesting nga yung anger kasi ngayon mas marami ng Pilipino tumitingin na sa mga expression nila on how they get mad. And people are already starting to recognize na hindi healthy na yung mga ginagawa nilang choices. Especially on how they talk to people, especially on how they relate to other people.